Good morning and welcome to the October 2024, almost Halloween, open meeting of the Federal Communications Commission. Now, before we begin our meeting, I just actually want to take a moment and talk about the work of FCC staff who were deployed to North Carolina and Florida during Hurricanes Helene and Milton. You know, when others evacuate, we have FCC employees who race to the storm. They start by performing pre-landfall spectrum surveys, which we use to help us gauge communications outages after the storm. And then they hunker down while the storm is present, and they often do so without water and without power. And on occasion, they've just been stuck in their vehicles through the night. But it's in the aftermath of a storm that they really get to work. They crisscross the disaster area to access damage to communications and assist FEMA with an understanding of the state of communications for recovery efforts. To be clear, they work 18 to 20 hours a day, and they use quick thinking and a whole lot of grit to meet the moment. Here's one example I just want to share with you. Following Hurricane Helene, our teams used specialized equipment that we actually purchased here to help improve our cellular survey capabilities. And these surveys are usually conducted through drive tests, like hundreds and hundreds of miles a day. But in North Carolina, flooding and debris made a lot of roads impassable. And one of our deployed FCC staff, Sean Cochran, had the idea that, well, maybe we could do these surveys with a low-flying plane. And thanks to his quick coordination with Civil Air Patrol, our FCC teams took their operations to the skies and drastically increased the service area and cut the service study time by several days. So I was with Sean in Asheville and the team that had been deployed, and I saw, and I think I was the first FCC leader to do so, firsthand, the devastation of this kind of storm and the work that these teams do. Their efforts are downright heroic. They help first responders locate survivors, and they help communities get on the road to recovery. So I just wanted to do something different and call them all out by name. So a big thank you to our staff who do this work and deployed to these storms, including Sean Cochran. We have Brian Britton, Paul Coburn, Bijan Cummings, Al Neer, Tim Perrier, Mike Peters, and Juan Silva from the Public Safety and Homeland Security Bureau, and Mike Mattern from the Enforcement Bureau. And we're really grateful that they are part of the FCC family. Now, Madam Secretary, would you please introduce our agenda this morning?
Thank you, Madam Chairwoman. Good morning to you. Good morning, Commissioners. For today's meeting, you will hear 2 items for your consideration and 1 presentation. First, you will consider a report and order adopting a 100% hearing aid compatibility requirement for all wireless handset models offered for sale or use in the United States and implementation provisions related to this requirement. Second, you will consider a 3rd report and order and 3rd further notice of proposed rulemaking that would adopt rules requiring wireless providers to implement a geo-routing solution for 988 calls to ensure that the 988 suicide and crisis lifeline can connect callers to geographically appropriate crisis centers based on the caller's general location. The 3rd further notice would also propose and seek comment on requiring covered text providers to support geo-routing for covered 988 text messages. 3rd, you will receive a presentation from the Connect to Health Task Force on updates to maternal health data in the Mapping Broadband Health in America platform. This is your agenda for today. Please note the item listed as 3rd, a Media Bureau restricted adjudicatory matter in the October 10th, 2024 Sunshine Notice, has been adopted by the Commission and deleted from today's agenda. Today's first item is titled Achieving 100% Wireless Handset Model Hearing Aid Compatibility and will be presented by the Wireless Telecommunications Bureau. Joel Taubenblatt, Chief of the Bureau, will give the introduction.
Thank you, Madam Secretary. Now, before we turn it over to Mr. Taubenblatt and what I like to think of as our regularly scheduled programming, we have 2 special guests. First, I'd like to introduce Linda Kozma-Spitek and Lisa Hamlin, who will provide remarks that are going to be included in the record. Ms. Cosma Spitek is a consultant to the Deaf and Hard of Hearing Technology Rehabilitation Engineering Research Center at Gallaudet University, which is our neighbor here in Northeast. And Ms. Hamlin is a consumer advocate who just very recently retired from her role as Director of Public Policy for the Hearing Loss Association of America. Sitting there, we have folks who have spent decades working for more accessible communications for those with hearing loss, including with the Hearing Aid Compatibility Task Force. Now, after their remarks, Mr. Tovenblatt will present the item, but I want to thank both of you for being here, for your presence, and also your long-standing commitment to what we're doing here today. So please proceed.
Thank you. It is an honor to speak before the Commission, especially about a topic that is so impactful for so many people, and one that I have worked on for most of my research career. The journey to 100% wireless hearing aid compatibility has been long and challenging. Technological advancements have provided both barriers to and opportunities for improved access. Consumer advocacy, accompanied by legislative and regulatory action, have been required to ensure people with hearing loss have access to effective telecommunications. The story I'm about to tell spans decades and is a testament to the power of perseverance in achieving goals. While the earliest telephone development at the beginning of the 20th century provided technology that stimulated the development of hearing aids, hearing aid users struggled with coupling their devices to telephones. In the 1940s, development of telecoils in hearing aids helped overcome this problem. Unfortunately, the successful use of telecoil coupling was tenuous because it relied on a characteristic of handset design that was completely unintentional. By the 1960s, design modifications changed this handset characteristic so much that contemporary hearing aid telecoils could no longer couple effectively to new handsets. A grassroots consumer group took action to find a long-term solution to the compatibility issue. This consumer advocacy effort led to significant legislative achievements. The Telecommunications for the Disabled Act of 1982 began the development of a national telecommunications policy for people with disabilities. Later, the Hearing Aid Compatibility Act of 1988 and accompanying regulations increased access by mandating hearing aid compatibility for all corded and cordless phones in the United States, thereby achieving 100% hearing aid compatibility for landline phones and setting a critical precedent for future action. The FCC rules implementing the HAC Act in the mid-1990s included two requirements for landline phones: compatibility with hearing aids through telecoil coupling and volume controls with a specified amount of amplification. Wireless phones were exempt from these rules. The early 2000s saw mobile phones grow in popularity and become a part of everyday life. At the same time, the complete transition from analog to digital wireless phones was taking place. With the use of digital wireless phones, consumers with hearing loss experienced interference to their hearing devices that made the phones nearly unusable due to the noise they created. In response to concerns raised by consumer advocates, the FCC partially extended its hearing aid compatibility requirements to wireless phones in 2003. A requirement to address interference was added alongside the telecoil coupling requirement for a percentage of wireless handsets. A volume control requirement for wireless phones followed later. This 2003 order laid the foundation for ongoing improvements to hearing aid compatibility in wireless phones. More than a decade after the partial lifting of the wireless exemption, the growth of smartphones had transformed telecommunications. This growth reflected the integral role of wireless phones in our daily lives, making them indispensable, and the achievement of 100% wireless hearing aid compatibility essential. The FCC understood that achieving this goal would require cooperation among multiple stakeholders. And in 2016, it encouraged the formation of the Hearing Aid Compatibility Task Force. The task force work has significantly advanced the goal of equal access to telecommunications for people with hearing loss, especially as wireless technology continues to evolve. In particular, the task force investigated the use of Bluetooth technology. While Bluetooth held promise for hearing device users as another coupling option that offered hands-free use, hearing devices could not support the power demands of traditional Bluetooth. Although low-energy versions of Bluetooth audio streaming eventually were integrated into hearing devices, these solutions were not universal, but specific to the wireless phone's operating system. Very recently, updates to Bluetooth introduced a universal, low-energy audio streaming solution along with new profiles designed to enhance interoperability between hearing devices and modern smartphones. By incorporating Bluetooth into the hearing aid compatibility regulations, alongside other coupling requirements, the FCC is accommodating both existing and emerging technologies to meet the diverse needs of consumers with hearing loss. The growth of smartphones also has expanded communication options, providing greater flexibility and choice, from internet-based voice calls and text to video conferencing and features like captioning. Even with these expanded communication options and shifts in communication preferences, voice telecommunication remains a cornerstone of how we connect. CTIA's 2024 annual survey reports that Americans collectively spent more than 2.4 trillion minutes talking on the phone. With 100% wireless handset hearing aid compatibility, the FCC is ensuring people with hearing loss have equal access to voice telecommunications and the benefits of the direct, reliable, and immediate personal connection it affords. Thank you. I'll now turn the floor over to Lisa Hamlin.
Thank you, Linda. Thank you, Chairwoman Rosenworcel, and thank you, commissioners, for having us here. Now, Linda has provided a terrific overview of the history of hack phones. For people with hearing loss, this is all too personal. In 1973, Reba Sachs, who advocated for telephone access alongside her husband, David Sachs, wrote of traveling without a hack phone. I couldn't reach my husband in the hospital. I couldn't talk to my family in Baltimore. I felt completely isolated from the world. I was in an environment that kept me in a constant state of anxiety. If 1973 seems like a long time ago, well, yes, it is. Times have definitely changed. But in an emergency, our experiences may rhyme with the past. If my cell phone was damaged in a hurricane or tornado, I would feel just as isolated as Reba if I could not get access to a hack phone. This order has been a long time coming. It's been 50 years since David and Reba Sachs advocated for equal access to telephones. It's been nearly 20 years since the Wireless Access Coalition petitioned the FCC to revoke an exemption for wireless phones. That's why consumers are so happy to see this day. It's why this order is so important. It means people with hearing loss will, for the first time, have equal access to all phones. Now, to get where we are today, we needed the engagement of all stakeholders, the wireless handset manufacturers and the service providers, the hearing aid industry, researchers, and people with hearing loss. Only working together would we have had any hope of achieving the goal of reaching equal access to all phones. I'm proud that I worked with the HAC Task Force as a representative of Hearing Loss Association of America. I'm proud that the HAC Task Force laid the groundwork for the order the Commission is considering today. Now, I would be remiss if I did not note that over the years, we've had the full support of the chairwoman, the commissioners, former chairman, and former commissioners. But not only that, the staff in the Wireless Telecommunications Bureau and the Disability Rights Office put in yeoman's work on this rulemaking and the many before. It is truly an achievement and a testament to the tireless work of the Commission. With this report in order, the goal of 100% hack wireless handsets is no longer just a dream. That said, it's a truism that the only constant in life is change. We can be pretty sure that the phone I'm using today will be different than the phone I use 10 years from now, even 5 years from today. I urge the Commission to continue monitoring the technology well into the future to ensure that when changes to the rules are needed, those changes happen, so that people with hearing loss will have equal access to telephone technology, well, forevermore. Thank you so much for having us here.
Thank you for your years of advocacy and also offering us some context here today.
Good morning, Madam Chairwoman and Commissioners. The Wireless Telecommunications Bureau is very pleased to present for your consideration today an item that would lead to the fulfillment of the Commission's longstanding goal of 100% compatibility of wireless handsets and hearing aids. I would like to thank the Wireless Bureau team for their hard work on this item, as well as the Office of Engineering and Technology, the Consumer and Governmental Affairs Bureau, and the General Counsel's Office for their contributions as well. With me at the table today are Barbara Esben, Deputy Bureau Chief of WTB, Susanna Larson, Assistant Bureau Chief, Garnet Hanley, Chief of the Competition and Infrastructure Policy Division, and Eli Johnson, Special Counsel in that division. And Eli will present the item.
Good morning, Madam Chairwoman and Commissioners. The Wireless Telecommunications Bureau presents to you today a report and order that advances the Commission's goal of ensuring that all Americans can access communication services on an equal basis by adopting a requirement that 100% of future wireless handset models offered for sale or use in the United States be hearing aid compatible. The order will ensure that Americans with hearing loss will have access to the same handset models as Americans without hearing loss. No longer will they be limited in their choice of technologies, features, and prices available in the handset model marketplace. The order determines that all future handset models must be hearing aid compatible, and that once the applicable transition periods ends, handset manufacturers and service providers may not offer for sale or use in the United States non-hearing aid compatible handset models. The order adopts transition periods of 24 months for handset manufacturers, 30 months for nationwide service providers, and 42 months for non-nationwide service providers. These robust transition periods will ensure that consumers with hearing loss promptly receive the benefits of our requirement that 100% of handset models must be hearing aid compatible. The order also adopts a Bluetooth coupling requirement that will benefit consumers by ensuring more universal connectivity between handset models and hearing aids, including over-the-counter hearing aids, and reduces the problem of certain handset models only being able to pair with certain hearing aids. In addition, the order establishes a volume control requirement that applies to all new handset models that handset manufacturers and service providers add to their handset model portfolios after the end of the relevant transition period for reaching the 100% benchmark for hearing aid compatible handset models. This requirement will benefit not only consumers with hearing loss who use hearing aids, but also consumers with hearing loss who do not use hearing aids. The order allows handset manufacturers and service providers to continue to offer handset models that are certified as hearing aid compatible under older certification standards, as long as these handset models were being offered prior to the end of the relevant transition periods. This approach will ensure that older hearing aid compatible handset models, which tend to be lower priced, continue to be available for consumers to consider for purchase during the remaining product cycle. The order adopts revised labeling and website posting requirements that will allow consumers to have access to the information that they need to make informed purchasing decisions. These revised provisions include a requirement that handset manufacturers and service providers post on their website point of contact information that consumers can use to ask questions about the compatibility of the handset models that these companies offer. In addition, the order adopts a revised reporting requirement. In addition, the order adopts revised reporting requirements that will allow the Commission to ensure compliance with our new hearing aid compatibility requirements. Finally, the order changes the name of the rules section from hearing aid compatible mobile handsets to hearing loss compatible wireless handsets, or HLC for short, in order to ensure that the heading of the rules section more accurately reflects the scope of the section. The Wireless Telecommunications Bureau recommends that the Commission adopt the report in order and requests editorial privileges to make technical or conforming edits. Thank you.
Thank you. We'll now hear comments from the bench. We start with Commissioner Carr.
Thanks so much. Thanks to the team as well for all the work on this. I think as we heard in the prior presentations, sometimes good things can take a little bit of time and a lot of effort, and this is one of them. We've taken a number of steps across the years to get here, and we take one more significant movement forward. We're going to enable nearly 50 million Americans with hearing loss to get to choose not just from a subset of handsets, but from all handsets. And I think that's a really good thing. It's a good item. Thanks to the chair for prioritizing this and getting it across the finish line.
Commissioner Starks.
Yes, thank you, Madam Chairwoman. Many days I'm proud to be a commissioner. I'm especially proud for the work that you talked about with Hurricane Helene, Hurricane Milton. That is work where we are helping real communities get back on their feet. In many cases, FCC staff are there on not even day one, on day zero. And that is deeply impactful. I'm equally proud of the work that we do today. Thank you for your testimony. As I've said when I voted for last year's hearing aid compatibility notice, everyone in America deserves access to modern communications. All means all. Today, 100% means 100%. And with this report in order, we're taking an important step towards ensuring that vision is a reality for the millions of Americans who depend on hearing aids. For years, the Commission has been working hard to make sure every single smartphone sold in America can be used with a hearing aid. Today, that goal is here and within reach by adopting the 100% hearing aid compatibility requirements for all future wireless handsets. We are delivering that meaningful choice to 48 million strong that have hearing loss. And this item is a result, as was said, of years of collaboration with industry, consumer groups, standard organizations, government, researchers. And so thank you to all who've helped. It's a culmination of a lot of work, and thank you to the Bureau for your continued hard work on this. It has my strong support. Thank you.
Thank you. Commissioner Symington.
Thank you. Glad to support today's item. It's an important item that fulfills a commitment to Americans with hearing loss, allowing them to choose from the same handset models that are available to consumers without hearing loss, thus advancing the Commission's goals of greater access to telecommunications for all Americans. So I want to thank WTB staff for their hard work on this important proceeding.
Commissioner Gomez.
Thank you, Madam Chairwoman. So today we decide that whenever a hard of hearing consumer in the United States buys a wireless phone, the phone will work with their hearing aids. With this simple yet monumental decision, we advance the FCC's goal of ensuring equal access to communication services for all. We also expand labeling requirements to keep consumers informed about the accessibility features of wireless phones. I am pleased that we also recommend making this information available in multiple languages, another way in which we further the Commission's goal of access to communication services for all. Thank you to Ms. Hamlin and Ms. Kozma-Spitek for your leadership on this issue, and thank you to the Hearing Aid Compatibility Task Force and the Wireless Bureau for your work on this item. And now I'd like to share my remarks in Spanish. Gracias a la resolución de hoy, cada vez que un consumidor con problemas de audición compre un teléfono móvil en los Estados Unidos, ese teléfono funcionará con sus audífonos. Esta resolución, simple pero extremadamente relevante, es un avance en las gestiones de la FCC destinadas a garantizar que todos tengan igualdad de acceso a los servicios de comunicaciones. Además, hemos resuelto ampliar la información del etiquetado que detalla las funciones de accesibilidad de los teléfonos móviles. Esto ayudará a los consumidores a conocer mejor las funciones de sus teléfonos. Y me complace agregar algo más. Hemos recomendado que la información del etiquetado esté disponible en varios idiomas, algo que también ayudará a facilitar el acceso igualitario a los servicios de comunicaciones. Thank you.
Thank you, Commissioners. Hearing loss is a big deal. In the United States, more than 48 million people have some form of hearing difficulty. Among older adults, it is especially prevalent, and it's also quite common among our veterans. So the chances are pretty good that you know someone who has been impacted by hearing loss. Now, the good news is that hearing aids and other technologies that can help those with hearing loss are more advanced, accessible, and affordable than ever before. 2 years ago, the Food and Drug Administration issued a landmark ruling making it possible for the first time for hearing aids to be sold over the counter and without a prescription. Just last month, the FDA approved the use of new technology that will allow popular wireless headphones to be used as hearing aids. These actions are really powerful because they are expanding consumer choice and lowering consumer cost. So I think now is the right time for the FCC to build on these efforts and finally deliver on a promise it made nearly a decade ago. Back in 2015, the agency adopted a collaborative plan to improve access to mobile wireless handsets that are compatible with hearing aids. The goal was to make them more widely available so that people with hearing loss could use their phones without interference to their hearing aids, and they wouldn't have to have unwanted noise during their conversations. Today, we take the final steps in that plan. We ensure that all mobile wireless handsets available in the United States will be hearing aid compatible. That means going forward, 100% of wireless phones will be capable of working seamlessly with hearing aids. Even better, we are improving the way these devices will work with hearing aids in the future. We clear the way for the use of new Bluetooth technologies that will help the growing number of new hearing aid options connect to mobile phones. We also adopt a volume control requirement for handsets that will benefit all consumers with hearing loss, even those that do not use hearing aids. We are reaching this 100% milestone because a lot of stakeholders worked with us to build consensus. In fact, many carriers and manufacturers have already contributed to this effort, with the majority of the handsets on the market today compatible with hearing aids. But today, we finished the job. And to get to this point, we relied on the work of the Hearing Aid Compatibility Task Force, which brought together the expertise of equipment manufacturers, wireless services, research institutions, and advocates for those with hearing loss. All together, they helped make it happen. I'm grateful for the knowledge and persistence of every member of the task force, including Linda Kosmek-Spytek and Lisa Hamlin, who join us here today. I'm also grateful to the staff who worked on this initiative, and there are a whole lot of them, so I'm going to call them out by name. Starting with Joel Talvenblot, Barbara Espin, John Lockwood, Kimia Nick Schreerest, Garnet Hanley, Susanna Larson, Eli Johnson, Jennifer Salhus, and Sarbu Shabra from the Wireless Telecommunications Bureau, Robert Aldrich, Stephen Wang, Joshua Mendelson, and Michael Scott from the Consumer and Governmental Affairs Bureau, Ryan McDonald, Regina Brown, Neil McNeil, and Pamela Hairston from the Enforcement Bureau, Dana Schaefer, Jameson Prime, Jim Sleliga, Justin Risson, Reza Bizaran, and Jamie Coleman from the Office of Engineering and Technology, Donald Stockdale, Catherine Matraves, Kenneth Lynch, Weiren Wang, Molly Schwartz, Zaira Gonzalez, and Craig Stroop from the Office of Economics and Analytics, Douglas Klein, Anjali Singh, Bill Huber, and Dave Konskal from the Office of General Counsel. as well as Michael Gusso and Shanna Wilkerson from the Office of Communications Business Opportunities. I want to thank everyone who's been involved in this long-haul effort. We will now proceed to a vote on the item. Commissioner Carr?
Approve.
Commissioner Starks?
Approve.
Commissioner Symington?
Approve.
Commissioner Gomez?
Approve.
The chair votes aye. The item is adopted with editorial privileges as requested. Madam Secretary, would you please announce the next item on today's agenda?
Madam Chairwoman and Commissioners, item 2 on your agenda is titled Implementation of the National Suicide Hotline Act of 2018 and will be presented by the Wireline Competition Bureau. Trent Harkrader, Chief of the Bureau, will give the introduction.
Thank you, Madam Secretary. Mr. Harkrader, when you are ready, please proceed.
Good morning, Madam Chairwoman and Commissioners. The Wireline Competition Bureau is pleased to present for your consideration a third report and order and third further notice of proposed rulemaking that, if adopted, would increase access to critical life-saving services by improving the routing of calls and text messages to the 988 Suicide and Crisis Lifeline. This is, of course, a cross-agency, but also a cross-government effort. And I would like to thank my Bureau, of course, and my colleagues in the Public Safety and Homeland Security Bureau for their very hard work, as well as colleagues in the Wireless Telecommunications Bureau, the Office of Communications and Business Opportunities, the Office of Economics and Analytics, and the Office of General Counsel for their crucial review and very helpful input. I would really also like to thank our federal partners at the U.S. Department of Health and Human Services Substance Abuse and Mental Health Services Administration for their work exploring and testing geo-routing solutions for the 988 Lifeline. Seated at the table with me from the Bureau are Sue McNeil, Heather Hendrickson, and Mary Wolf. And then from the Public Safety and Homeland Security Bureau, Brenda Boykin, Rachel Weir, and Timothy Hosseth. Mary Wolf will now present the item.
Mental health and substance use challenges continue to profoundly impact many people living in the United States. According to the Centers for Disease Control and Prevention, suicide is the leading cause of death in the United States, resulting in over 49,000 deaths, or approximately one death every 11 minutes in 2022 alone. The 988 Suicide and Crisis Lifeline, which consists of a national network of over 200 crisis centers, provides critical 24/7 confidential support for people experiencing emotional, suicidal, and substance use crises. The Lifeline offers call, text, and chat services in English and Spanish, and interpreter services are available for more than 240 languages. Since the nationwide transition to 988 in July 2022, the Lifeline has received over 10 million calls, texts, and chats. Mental health and crisis counseling experts emphasize the importance of connecting help seekers to local crisis centers to ensure they have access to public safety and mental health resources in their communities. Based on the original design of the 988 Lifeline's routing platform, however, callers may not receive support from local crisis centers. The majority of calls to the 988 Lifeline are made from wireless phones, and the Lifeline system currently routes those calls to crisis centers based on the caller's area code and exchange, which may not match the caller's physical location. Recognizing the importance of connecting help seekers to local crisis centers, the Commission has taken action to facilitate the development of geo-routing solutions. With geo-routing data, the 988 Lifeline will be able to route wireless calls to local crisis centers based on the geographic area where the handset is located at the time the 988 call is initiated, while maintaining privacy by not identifying the caller's precise location. This third report and order, if adopted, would facilitate access to the 988 Lifeline's critical local intervention services by requiring nationwide and non-nationwide wireless providers to implement a geo-routing solution for 988 calls. If adopted, the third report and order would define geo-routing data as location data generated from cell-based location technology that is aggregated to a level that will not identify the location of the cell site or base station receiving the 988 call, or otherwise identify the precise location of the handset. The third report and order, if adopted, would then require all wireless providers to have the capability to provide geo-routing data with 988 calls to the Lifeline administrator in a format that is compatible with the Lifeline's routing platform. The third report and order would also require wireless providers to transmit geo-routing data with 988 calls when available that is sufficient to allow routing of the 988 call by the Lifeline administrator to the appropriate crisis center based on the geographic area where the handset is located at the time the 988 call is initiated. If adopted, the third report and order would establish an implementation timeline of 30 days for nationwide providers and 24 months for non-nationwide providers following the effective date of the rules. To provide greater flexibility for wireless providers in implementing geo-routing solutions that may require broader routing parameters, the third report and order would revise the Commission's existing 988 voice and texting rules to allow for routing to the Lifeline without translation to the toll-free access number. While individuals would still be able to dial the toll-free number, this revision would avoid potential confusion when a number other than 988 appears on a help seeker's device when receiving a response from the Lifeline. This would also codify a May 2022 order that granted a waiver of the Commission's rules to ensure that return text messages appear on consumer devices as coming from the 988 Lifeline. Recognizing the importance of enhancing the support and resources available to text users in crisis, the third further notice of proposed rulemaking, if adopted, would propose and seek comment on requiring covered text providers to support geo-routing to ensure that the Lifeline may route covered 988 text messages to appropriate local crisis centers. The third further notice would seek comment on requiring covered text providers to have the capability to provide geo-routing data with covered 988 text messages to the Lifeline administrator and provide geo-routing data when available with covered 988 text messages to the Lifeline administrator. Lastly, the third further notice would propose an implementation deadline of 6 months following the effective date of the final rules for covered text providers to comply with the proposed text to 988 geo-routing requirements. The Bureau recommends adoption of this third report in order and third further notice of proposed rulemaking and requests editorial privileges. Thank you.
Thank you. We will now hear comments from the bench. Commissioner Carr.
Thanks. Thanks so much to the team for the work on it. I know this issue doesn't generate all the same types of headlines that a lot of other stuff that either we do or that happens in tech and telecom space, but I think it's probably fair to say this might be the most consequential initiative that we've worked on. And I think, like a lot of good things like that, it's one that's cut across administrations, across chairmanships. President Trump signed legislation to get this going. President Biden has helped move it forward. Chairman Pai sort of started the first proceedings, and Chairwoman Rosenworcel has been making sure that it gets fully implemented and continues to advance. I think like a lot of us up here, I've had the chance to visit these 988 call centers. I remember one in particular back in 2020. I went up to Baltimore, to the Baltimore Crisis Response Center, and got to spend time with Edgar and his team, and he introduced me to one of the call takers. There's a guy named Elijah. And anyone that has spent time at these call centers knows that these call takers are just some of the best salt of the earth people out there. They're hard jobs, right? I mean, you're literally there to help someone out during the worst, darkest moment in their life. And what Elijah said to me at the time was the best part of the job is weeks later, getting the chance to hear back from some of the people that have been going through a rough time and hearing that they're on the other side, they're doing better, and having the opportunity to just play a small part in that. And so whether it's Elijah or visiting similarly with a call taker up in Sioux Falls, South Dakota, Janet, at one of the 988 facilities there, you're really struck by the talent. Anything that we can do to help more people reach those types of people, like Janet, like Elijah, we should be doing it. And one of the things that I think all of us heard and the chair heard was if we can route these so people in those communities get connected with local resources, it can only help to make this entire system more beneficial and productive. And it's one of those ideas that, it's a no-brainer, of course, do that. And then you scratch beneath the surface and it's a little more complicated, a little more difficult, including privacy concerns, right? We want to make sure that you get routed, but you're protecting the privacy nonetheless of the caller. And we've been able to do that. And so I want to thank the chair for her leadership on this and the team for all the hard work. It's got my support. Thanks.
Commissioner Starks.
Yes, thank you, Madam Chairwoman. 988, as we heard, is made up of more than 200 crisis centers across the country. I, too, visited one, and mine was just last week. I wanted to make sure that I saw how this was really going to get implemented and talk through a team in real time. Lines for Life in Portland, Oregon is dedicated to preventing substance abuse, suicide, and promoting mental wellness through intervention, prevention, and advocacy. It's the largest 988 center in Oregon, one of the largest in the Pacific Northwest. It fields calls from 34 of Oregon's 36 counties. It has 270 employees, 90 full-time call responders, 80 volunteers, and Lines for Life responds to more than 60,000 calls per year. So on my visit, I got to speak with Debbie, who started out as a volunteer but handles thousands of calls, the most there at Lines for Life. And she's now one of the center's leaders, as she should be, and really helps lead the training for the other call takers. And she mentioned, of course, in the course of our dialogue, the necessity of matching 988 callers with local responders, really saying, quote, "We have our fingers on the pulse of the mental health resources, really a resources issue in the area," close quote. And without missing a beat, one of the co-workers, Alexis, added that, "I note that we have it on a county-by-county basis here." Again, part of their footprint there in Oregon. And so throughout their years of experience, Debbie, Alexis, the entire team really just unfolded the way that they know the best ways to help someone in crisis get connected with the right resources in their own community, whether that's mental health counseling, addiction services, housing resources. The Lines for Life team kind of really helps treat that caller in a very acute phase, of course, with the most assets that are available equipped to the caller. And so that's why today's action really is that important, making sure that Americans who reach out to 988 get connected with a local resource, somebody who's going to help get them what they need the most and hopefully the most quickly. The Lines for Life team also highlighted their work with numerous tribes that live in the Pacific Northwest, and told me at length how that worked there in Oregon. But it, also heard a similar refrain that the lack of connectivity there in some of the tribes limits their abilities to recommend certain resources, virtual therapy, telehealth, telemedicine, as options that can help with hearing and getting somebody repeat care that they may need. Lines for Life also operates an innovative youth line service, a free teen-to-teen crisis support and helpline, teens helping teens, young adults helping young adults. I spoke with Morgan, who's the manager of the young volunteers there, and she impressed upon me the capacity that she sees for compassion, understanding, healing, and one of the youth, a teen, literally, who is helping her other teens. Her name was Julie, the volunteer I'll never forget, and she said, "I want to help other kids understand that they are not broken." And that will really resonate with me for quite some time as I think about this. Very, very pleased with the work that we've made, the progress that we've made in a very short amount of time here. Thank you to the chairwoman for continuing this work. It has my full support. Thank you.
Thank you. Commissioner Symington.
I'd just like to thank everyone for their hard work on this important item.
Thank you. Commissioner Gomez.
Thank you. Since becoming a commissioner, I have embraced every opportunity to speak with stakeholders about the challenges that they face and how we can be of help. In fact, my first visit as a commissioner was to 988 call center, Every Mind call center in Rockville, Maryland. Time and again, across many different communities, I have heard stories of how important the 988 lifeline is for individuals in need of support. So today, we affirm the experiences of these individuals and take steps to enhance the life-saving capabilities of this service. Doing everything we can to ensure that individuals experiencing a crisis can receive the support they need saves lives and is simply good policy. I look forward to the continued implementation of geo-routing solutions and seeing the record develop with solutions and ideas for text messages. Thank you to the staff of the Wireline Competition Bureau and the Public Safety and Homeland Security Bureau for your valuable work on this item. And now I would like to share my remarks in Spanish. Desde que asumí el cargo de comisionada, escucho a los consumidores cada vez que tengo la oportunidad para saber cuáles son sus principales inquietudes y cómo la comisión puede ayudarlos. En todas las comunidades he escuchado relatos sobre lo importante que es la línea 988 para las personas que necesitan apoyo emocional. Hoy adoptamos medidas para mejorar el servicio de la línea 988. Me entusiasma la implementación de tecnologías de geoenrutamiento en las llamadas y la continua búsqueda de soluciones para los mensajes de texto. Estamos haciendo todo lo posible para garantizar que las personas que atraviesan una crisis puedan recibir el apoyo que necesitan. Así ayudaremos a salvar vidas. Thank you.
Thank you. So yesterday, I was in California, and I joined Department of Health and Human Services Secretary Becerra and Congressman Cardenas and visited Sycamores, a community-based resource center that helps adults, children, and families through some of their darkest and most difficult times. Sycamores is rooted in Los Angeles. They know what is happening in their backyard, they know what their neighbors need, and they have mobile mental health teams ready to provide on-the-ground assistance. I got to see how they work and how they deploy when crisis calls in their community. When the original Suicide and Crisis Lifeline was launched in 2005, it was a 10-digit number, and the system used the area code associated with your phone number to route your call, so those who answered could help nearby. Back then, when most calls came from a landline, routing by area code made sense. The times change. Today, thanks to a multi-year effort of the Federal Communications Commission, the 10-digit lifeline is now an easy-to-remember 3-digit number, 988, and 80% of the calls to 988 now come from a wireless phone. For so many people, the area code on our wireless phones no longer matches the place where we live. That means if you have a phone number from Maryland but moved to California and dialed 988 in crisis, you would be routed to a center providing assistance in Maryland. Counselors in Maryland would still do their absolute best to assist you, but it goes without saying they won't be in a position to connect you with local resources like Sycamores in California. This is a mismatch I have long believed we should fix, and I believe we can save more lives if we do so. Because if we get more people connected to the Suicide and Crisis Lifeline to resources that are local, we can help more people with more meaningful assistance in more places. And that's where geo-routing fits in. When geo-routing is used, wireless calls to 988 are routed to call centers based not on the area code, but instead on the presence of the nearby towers that wireless calls use to connect. This provides a more accurate picture of the caller's general location while still protecting the caller's basic privacy. More importantly, geo-routing means that those responding to 988 inquiries have a lot more knowledge of local resources and local events, and they're just better equipped to assist the caller with getting the help they need. Now, we've already made real headway getting geo-routing in place for 988 calls. The FCC has been working with our federal partners at the Department of Health and Human Services and the Substance Abuse and Mental Health Services Administration to implement this technology. And last year, I kicked this effort off by writing letters to the nationwide wireless providers, urging them to explore geo-routing with development, testing, and trials. And that work has paid off because we right now have 2 nationwide wireless providers launching geo-routing for 988 calls last month. And the third provider tells us they will be on board shortly. I am so grateful for this progress, but we can't fall back. We need to make sure everyone calling 988 from a wireless phone can get connected to help that is nearby. So today we're setting clear deadlines for wireless providers across the country to implement geo-routing for calls to the Suicide and Crisis Lifeline. But we're not stopping here. There's more we can do to improve access to 988 and making sure those who reach out in crisis get the local support they need. Years ago, I led this agency's work to support texting to 988. expanding the lifeline to take more than just traditional phone calls. After all, this is the way so many of us use as our primary communications today, especially young people. So in addition to requiring geo-routing for 988 calls, today we are launching a rulemaking to determine how best to implement geo-routing for 988 texts. Now, texting technology is different and presents special challenges because texts contain unique information and move along a different pathway than traditional phone calls. So while the Lifeline's administrator can receive text to 988, there's currently no way to also receive geo-routing data from the text sender. But when there's a will, there's a way, and we're not going to stop working to improve the Lifeline until everyone gets access to the local help and resources they need. So I want to thank Congressman Cardenas and Secretary Becerra for joining me at Sycamores and being such terrific champions of the work we are doing with 988. And their drive to set up and improve the 3-digit Lifeline is really a big reason why we're here today. I also want to thank Senator Padilla and Senator Tillis for their support on Capitol Hill. Most of all, thank you to Sycamores for the gracious way they opened their doors for us and for the heroic care and services they and so many others like them around the country provide to people in their community. Finally, I am grateful to the staff responsible for this effort, including Callie Coker, Jesse Goodwin, Trent Harkrader, Heather Hendrickson, Jesse Jackman, Jody May, Christy Schumann, and Mary Wolf from the Wireline Competition Bureau. Brenda Boykin, John Evanoff, David Firth, Timothy Hoseth, Renee Rowland, Rasul Savavian, and Rachel Wurr from the Public Safety and Homeland Security Bureau. Garnett Hanley, Leon Jackler, John Lockwood, and Susan Mort from the Wireless Telecommunications Bureau, Terry Kavanaugh, Douglas Klein, Richard Mallon, Erica Olson, Elliot Tarloff, and Shin Yu from the Office of General Counsel, Stacy Jordan, Eugene Kiselev, and Eric Ralph from the Office of Economics and Analytics, and Michael Gusso and Jocelyn James from the Office of Communications Business Opportunities. And with that, we will proceed to a vote on the item. Commissioner Carr.
Approve.
Commissioner Starks.
Approve.
Commissioner Symington.
Approve.
Commissioner Gomez.
Approve.
The chair votes aye. The item is adopted with editorial privileges as requested. Madam Secretary, will you please announce the next item on today's agenda?
Madam Chairwoman and Commissioners, third on your agenda is a presentation from the Connect to Health Task Force on updates to maternal health data in the Mapping Broadband Health in America platform. Karen Onije, Chief of Staff of the task force and Deputy General Counsel, will give the introduction.
Thank you, Madam Secretary. Now, before we proceed with the task force's presentation, we are first slated for a virtual presentation from Dr. Veronica Gillespie-Bell. Dr. Gillespie-Bell is the medical director of the Louisiana Pregnancy-Associated Mortality Review and the Louisiana Perinatal Quality Collaborative. So with the advent of modern technology, there we go. Dr. Gillespie-Bell, welcome to the FCC's monthly meeting, and please proceed with your remarks.
Madam Chairwoman and Commissioners, good morning. Thank you so much for having me. As mentioned, I am the Medical Director of the Louisiana Perinatal Quality Collaborative and the Pregnancy Associated Mortality Review for the Louisiana Department of Health. I'm also a board-certified obstetrician and gynecologist for Ochsner Health practicing here in New Orleans. I am grateful for the opportunity to appear before you today to talk about the maternal health crisis in the United States, but more importantly, what we can do to improve our maternal health crisis. The United States has the worst maternal health outcomes of any high-income country, and worldwide maternal mortality is declining, but the problem is getting worse in the United States. And we have disparities. 3 Black women die at a rate of every 1 white woman. 2 Alaska Native American Indian women die at the rate of every 1 white woman. We also have disparities as well as complexities around rurality as well. This affects our maternal outcomes. In fact, the pregnancy-related mortality ratio is the highest in the non-core or rural population. When we look at those deaths, the majority of deaths are actually not happening during pregnancy. They're happening after delivery up to 1 year postpartum. And the majority of those deaths are happening in the first 6 weeks. And if we think about how we have healthcare, most patients are disconnected from healthcare during that time. And when we look at these deaths, the majority of them are preventable. This is a public health crisis. And that means it requires a multidisciplinary approach that not only addresses improving clinical quality of care, but also systems of care as well as social factors impacting care. In fact, 80% of clinical outcomes are actually due to social determinants of health, and inequities in the distribution of resources that impact social determinants of health contribute to these disparities that we see in maternal health outcomes. Whether that resource be transportation, childcare, or just economic stability, I personally see my patients impacted by these barriers, making it harder for them to access care and achieve healthy outcomes. It is time to unstick those barriers. Broadband and telehealth are ways to improve access to care. But like all other resources, there has been an unfair distribution of this resource. And we must follow the data to understand how the maps of poor health outcomes overlap access to broadband. So I will say, access to broadband is another social determinant of health. We stand at the precipice of a solution to our maternal health crisis. Imagine every family having access to a postpartum mood and anxiety check after delivery from the comfort of their own home. I can imagine it because I provide it. Imagine every patient having a 1-week blood pressure check from the comfort of their home. I can imagine it because I do it. Imagine the US leading the world in maternal health. We can achieve it. With important resources like the FCC's mapping platform, connected health is a pathway to that goal. Thank you very much.
Thank you so much for offering that context from Louisiana. Proceed, Karen.
Good morning, Madam Chairwoman and Commissioners. The FCC's Connect to Health Task Force in the Office of General Counsel is pleased to present to you a preview of the updated Mapping Broadband Health in America platform. As Michelle Ellison, the chair of our task force, often says, we cannot mend what we cannot measure. And for the last several years, the task force has been endeavoring to do just that, measure, identifying and visualizing the opportunities and gaps at the intersection of broadband connectivity and health. Initially launched in 2016, the Mapping Broadband Health in America platform was, and continues to be, a first-of-its-kind endeavor. It allows users to visualize, overlay, intersect, and analyze broadband health and demographic data at the national, state, and county level, providing compelling insights about the relationship or correlations between broadband and health outcomes. Since we last presented to the Commission a year ago, the task force has been hard at work, researching, developing, innovating, strategizing, listening, learning, and continuing to help move the needle on broadband health. Now, the task force's initiatives are expansive, but today we'll be focusing on our efforts to expand, refine, and enhance the broadband health mapping platform with a particular emphasis on maternal health. With me at the table are Dr. Chris Gibbons, Senior Health Advisor and former Assistant Professor of Medicine, Public Health, and Health Informatics at the Johns Hopkins University. Dr. David Ahern, Senior Health Advisor and Director of Digital Behavioral Health and Informatics Research at the Brigham and Women's Hospital and a member of the faculty of Harvard Medical School. Braden Parker, Legal Advisor, Cheryl Wilkerson, Special Counsel, and Irene Lee, Attorney Advisor in the Office of General Counsel. Braden will now provide an update on our recent work on the platform, followed by a recorded demo previewing the 2024 version.
Thank you, Karen. Good morning, Madam Chairwoman and Commissioners. The maternal health crisis, as Dr. Gillespie Bell so powerfully laid out, demands our attention, and it requires us to use all of the creativity, ingenuity, and resources at our disposal. The Commission has been on the cutting edge of connected health. So when Congress wanted to identify areas of the country where maternal mortality and severe maternal morbidity rates are particularly high and where critical telehealth resources are most needed, they knew that the Commission's broadband health mapping platform could help achieve that objective. In December of 2022, Congress passed the Data Mapping to Save Moms' Lives Act and tasked the Commission with extending the power and promise of the platform to maternal health. Specifically, the Act instructed the Commission to incorporate publicly available data on maternal mortality and severe maternal morbidity into the agency's Mapping Broadband Health in America platform within 180 days and to consult with the Centers for Disease Control and Prevention. Over the course of 6 months, we developed an initial conceptual framework to guide the incorporation of maternal health data and its intersection with broadband. We collaborated with our colleagues at the CDC and the Health Resources and Services Administration. And in June 2023, we released the first iteration of the maternal health platform, for the first time allowing stakeholders to visualize and analyze the intersection of broadband and maternal health. Recognizing that there was more information, user feedback, innovative ideas to uncover, in October of last year, the Commission adopted a notice of inquiry, seeking public comment on ways to further expand, refine, and enhance the mapping platform. The Commission also hosted a joint roundtable with the Department of Health and Human Services on the connected future of maternity care, convening national thought leaders from a variety of disciplines. We received valuable input from critical constituencies, including grassroots maternal health advocates and rural health organizations, recommending the inclusion of specific data relevant to their work. To supplement these more formal efforts, the task force also engaged with our sister agencies to more fully understand how the mapping platform could aid them in their critical effort to improve maternal health. By consulting with the Centers for Disease Control and Prevention, the Health Resources and Services Administration, the Department of Veterans Affairs, the National Telecommunications and Information Administration, the U.S. Department of Agriculture, the Indian Health Service, the Substance Abuse and Mental Health Services Administration, and many others, we have worked to ensure that the platform includes the necessary data and functionalities to promote data-driven decision-making for our nation's broadband and maternal health policymakers. In a few minutes, we'll share a preview of the 2024 platform and some of the innovative enhancements that users can expect next month when these upgrades are rolled out. Overall, the platform is more intelligent, expansive, and analytic. One of the critical challenges we faced in the June 2023 release was the lack of publicly available data at the county level for maternal mortality and maternal morbidity. Much of that data is suppressed or not reported in order to protect the privacy of mothers and their families. Our solution was twofold. First, the platform now visualizes proxy variables like low birth weight and preterm birth because of the impact that these can have on a mother's physical and mental health. In addition, the platform now allows users to intersect broadband data with key risk factors like diabetes, hypertension, and obesity, enabling new insights in the broadband and maternal health space. On the broadband side, the platform also incorporates availability data from the FCC's broadband data collection, including the revised definition of broadband to reflect higher speeds and showcasing new dimensions of broadband access. For the first time, users will be able to visualize mobile data alongside health metrics. We've also included fixed and mobile access variables, allowing users to visualize where consumers can utilize that always-on 24/7 high-speed connection, which can be critical for broadband-enabled interventions like remote patient monitoring. We've expanded our internet adoption data as well, including a new metrics from the American Community Survey to provide a more complete picture of who has the digital tools necessary for connected care. Leveraging the task force's county categorization framework, the user experience has also been completely re-engineered, and it's accessible now on laptops, tablets, and smartphones. The 2024 release will integrate all of the health domains available on the platform: maternal health, chronic disease, opioids, and soon cancer and heart disease, providing a cohesive, streamlined tool for all stakeholders. We'll now turn to a brief demo previewing the 2024 updates to the mapping platform and see how it can be used to visualize the broadband health gap, inform data-driven decision-making, and truly move the needle in broadband and maternal health.
The Connect to Health FCC Task Force at the Federal Communications Commission is excited to preview the next iteration of the groundbreaking Mapping Broadband Health in America platform. As you'll see, this platform is not just a series of maps. It reflects a new way of thinking about, a new way of visualizing and analyzing the intersection of broadband connectivity and health. In the next 5 minutes, we'll highlight just a few examples of the platform's capabilities and innovative functionality. In addition, we'll tackle 3 sample questions about broadband and maternal health that the new platform, when launched, will help you ask and answer. With that, let's get started. One of the biggest challenges the new platform tackles is how to intersect county-level broadband with maternal mortality data, given the data suppression inherent on the health side. To put our progress in perspective, a picture is worth 1,000 words. This was the platform then. You can see most of the data on maternal mortality rates is suppressed or grayed out. And this is the platform now. We're leveraging proxy variables like preterm birth and low birth weight to light up the map and allow stakeholders to extract actionable insights around broadband and maternal deaths, something we couldn't do before. Here, we've intersected internet adoption and preterm birth, and what you're seeing is one picture of the digital divide in maternal health. In the purple, double burden counties, 4 in 10 households do not have a high-speed internet connection, and there are higher risks for preterm birth. Increasing internet adoption at adequate speeds in these priority areas may help improve maternal health and reduce risks of maternal death. And to take this a bit further, let's filter by race and ethnicity, and let's further filter by maternal age. Imagine, what if broadband could transform access to maternity care? Let's acknowledge a sobering reality. In an ideal world, if a pregnant woman could not access a doctor, hospital, or midwife near her home, she would have robust digital or virtual resources to help bridge the access to care gap. For many mothers in the United States, that is not their reality. In fact, over the past 5 years, more than 100 rural hospitals have stopped delivering babies, and by current estimates, 700 rural healthcare facilities are at risk of closing. We know that broadband can make a difference, and the platform puts the power of the data in the palm of your hand. This first map we've generated shows the rural broadband and access to care gap for maternal health. It tells you exactly where we need to intervene. The counties in purple are double burden, all 560 of them. They have below average fixed broadband access and are designated as maternity care deserts, which means that in these counties there is no hospital, no birthing center, no midwife, or other obstetric care provider available. But the new platform can show us even more. By applying one of the platform's powerful new filters, we can now see that in more than half of those double burden counties, again colored here in purple, the majority of households do not own a car, exacerbating the lack of connectivity and access to care problem. And we visualized those priority counties with just a couple of clicks. Here's another twist. What if a policymaker or public health department or broadband provider wanted to know where to intervene, or was hoping to isolate where new infrastructure should be prioritized, or wanted to identify where women are at the highest risk across both broadband and health? All the user would need to do is to further tailor the map by focusing on the subset of counties where, for example, women lack access to adequate food. According to the CDC, food insecurity places women at a higher risk for maternal death. In seconds, you would see the places in rural areas where increasing broadband resources could extend a critical lifeline. But there's so much more that the platform can show you. And access to care is only part of the story. What if you could paint a picture of broadband connectivity in areas where pregnant women face life-threatening risks of gestational hypertension and diabetes. The platform takes this challenge and raises the bar, providing multiple ways to slice and dice the data. This next picture is from the platform's broadband view. With a few clicks, we see a color-coded map of access to both a fixed broadband and mobile connection, but only in areas with above-average rates of pre-pregnancy or gestational hypertension or high blood pressure. You can see the counties with lower connectivity metrics in beige and gray, particularly in the South, Southeast, and Ohio River Valley. The platform also allows you to pivot and explore geographic differences. Notice how, when we intersect with pre-pregnancy or gestational diabetes, the areas of need shift north to Appalachia in the Midwest. To put it another way, these maps visualize the work that remains before we can extend an always-on connection to every pregnant woman facing the highest risks. That way, their doctors can monitor them remotely and intervene in case of emergency. Now let's be clear, this is far from an academic exercise. Each of these visualizations represents real families potentially facing tragic loss. As you can see, the new platform is highly customizable and user-driven. In this short preview, we've barely scratched the surface of the new platform's capabilities. There are many stories lurking in the data waiting to be told, so the way that you use the platform may not be the way that others do. And that is the true power of mapping broadband health in America.
So, Madam Chairwoman and Commissioners, thank you again for the opportunity to provide this update. As you can imagine, this effort involves broad collaboration across the agency and among various public and private stakeholders, and we would be remiss if we didn't mention just a few. We'd like to extend our sincere gratitude to our sister federal agencies with whom we've been coordinating and who have provided expert input, especially our partners at the CDC and HRSA. We're also grateful for the technical assistance and support we continue to receive from our colleagues at the MITRE Corporation, as well as the information technology staff here at the FCC. The task force remains committed and hopeful about the transformative power of broadband and health, where everyone, everywhere, is connected to the people, services, and information that they need to get well and stay healthy. Thank you.
Thank you so much. The work that the task force is doing on this is so tremendous. I wanted to highlight it at this meeting. So let me ask any of my colleagues if they have a statement. Commissioner Carr.
Yep.
Commissioner Starks.
Yes. Well, thank you, Dr. Gillespie Bell. Thank you, Doctor. Thank you, Doctor, for being here. My father, as many of you know, is a physician, actually an OBGYN. And so this really matters to me personally, in addition to the policy that we're talking about here today. And so, you know, the disparities that we're talking about, rurality, communities of color, vulnerable households, low-income households, the intersection of all of these. You know, no doubt if you're in a doctor desert, you're probably in a broadband desert. If you're having transportation insecurity issues, you're having digital security issues, and so deeply appreciate the work that that has been going on and the updates. Thank you for keeping us apprised, and look forward to continuing about the hard work. Thank you, Chairwoman, and thank you, Michelle Ellison. I know she's not here today, but I know this has been absolutely part of her continued push, and so thank you to the General Counsel as well.
Thank you. Commissioner Symington.
Nothing, thank you.
Commissioner Gomez.
Thank you, and thank you to Dr. Gillespie Bell and Braden for the presentation. The increase in maternal mortality and morbidity in our nation is a devastating, complex, and multifaceted issue. This crisis is particularly devastating for Black women, for Native women, and women in rural communities who all experience higher rates of maternal mortality and morbidity. The CDC reports that more than 80% of these deaths are and complications are preventable. So this is unacceptable. We must do more. That is why I'm grateful that Congress gave us the tools to act by passing the Data Mapping to Save Moms' Lives Act. Data is powerful. The progress made will be instrumental in targeting areas where telehealth can improve maternal health outcomes. Of course, identifying these areas is not enough. We must ensure that these areas have access to affordable, reliable, high-speed broadband and tools necessary to connect to providers. So we continue to work on that piece as well at the Commission, but I'll take this opportunity to reiterate the need for Congress to fund the Affordable Connectivity Program. With the data presented today and resources to help struggling families remain connected, we have the potential to save lives. So I look forward to the continued progress of the Mapping Broadband Health Platform and sharing this tool with leaders throughout the nation to address this crisis. So thank you to the Connect to Health Task Force for your continued work on this important issue and for this presentation today.
Thank you, Commissioners. Heard it before, but I think we can't stop saying it. The United States has the highest level of maternal mortality of any industrialized country. And deaths from pregnancy-related causes strike women of color and those who live in rural communities especially hard. Like you heard Dr. Gillespie Bell say, this is a crisis. It requires everyone, let me underline everyone, to identify how they can help, because studies show that most pregnancy-related deaths are preventable. Something else that I've pointed out before, I am the first woman to permanently lead the Federal Communications Commission. I'm also the first mother to ever do so. That means we're going to step up and do our part. And nobody said this was easy. The reasons for the situation we are in are complex: court decisions, legislation that cuts women off from their doctors, hospital closures, the rising cost of care, and the declining ability of too many to access the care they need. We need to untangle them. Along the way, we know that access to broadband-enabled solutions like telehealth can play a role in improving maternal outcomes. That is why last year we used authority under the Data Mapping to Save Moms' Lives Act to update the agency's Mapping Broadband Health in America platform to include maternal health data. It is a tool that can help us better understand the intersection of broadband access and maternal care and the possibilities that telemedicine presents. Then we opened an inquiry to engage policymakers, healthcare professionals, and groups advocating for better care to understand the ways this data can assist efforts to address the maternal health care crisis. So many stakeholders responded to our inquiry with a whole lot of thoughtful ideas. We took a cue from them, and that is why today we're sharing that we're updating our platform with new data. Next month, we will be adding information proxies to the Mapping Broadband Health in America platform, and we developed them with the assistance from the Centers for Disease Control and Prevention and the Health Resources and Services Administration to help us close gaps in reportable maternal and morbidity data. We're also adding facts about infant health outcomes, breast cancer, and data that reflects social determinants of health, like food insecurity. On top of this, we've refined our own broadband mapping data so that it is more accurate and reflects new and higher broadband speed standards. These improvements are meaningful, and over time, I expect they will yield new insights into our maternal health crisis, one as a nation we have got to fix. I want to thank our federal partners for their ongoing support and their work with us to improve the usefulness of this platform so that practitioners, researchers, and other stakeholders can delve deeper into the intersection of broadband connectivity and health in the United States. In addition, I'm really grateful to those who champion this work for us in Congress, and that includes Senator Rosen, Senator Fisher, Senator Young, Senator Schatz, Representative Bilirakis, Representative Blunt Rochester, and former Representative Butterfield. A special thank you as well to Dr. Gillespie Bell for her insights and work on the front lines to combat this country's maternal health care crisis. Lastly, thank you to our Connect to Health Task Force Chair, Michelle Ellison, who is here with us today in spirit because she has motivated us consistently to work on this, do more, and do better. And I also want to thank David Ahern, Ben Bartolome, Chris Gibbons, Irene Lee, Karen Onije, Braden Parker, Elliot Tarloff, and Cheryl Wilkerson from the Office of General Counsel, Gerald Mays, Erica Olson, Mitzi Paramenter, Elizabeth Redding, Tadel Schifferah, Georgette Sumter, Don Tweedle, and Chris Weber of the Office of Managing Director, Steve Kaufman and Alexander Simmons of the Office of Economics and Analytics, as well as Chris Gibbons. Thank you all for your help and for this presentation today. Before we conclude, would any of my colleagues like to make any announcements at this time? Commissioner Carr? Commissioner Starks? Commissioner Symington?
None, thank you.
Commissioner Gomez?
Not today, thanks.
Oh my gosh, that's brand new. All right. But I got one or two. The Office of Native Affairs and Policy has welcomed 2 new policy advisors to grow our efforts and work with ONAP's Chief Bambi Kraus to expand the Commission's outreach and engagement on issues that involve communications in tribal communities. And with their backgrounds in public service, they're going to bring a lot of skill to this effort, and I just want to thank them for joining us. They include Cranell Alfred, who joins ONAP after 15 years of experience working in our nation's capital on issues that impact Indian country, including serving as the tribal liaison for USAC during the COVID-19 pandemic. She has a master's degree in policy from the Harvard Kennedy School and has notably worked for the Navajo Nation, the Department of Interior's Office of Public Affairs, and 2 national Indian organizations. She herself is a member of the Navajo Nation, and we're so grateful she's joining us. We are also being joined by Jack Jackson Jr., who is also a member of the Navajo Nation, and he brings over 30 years of public service on behalf of tribal nations. He's worked for the Navajo Nation, the National Indian Education Association, the National Congress of American Indians, and Mr. Jackson served in the Arizona State Legislature in both the House of Representatives and Senate, representing diverse communities, including several tribal nations. He's also served as a senior advisor and liaison for Native American Affairs at the U.S. Department of State, and most recently as the tribal liaison at the U.S. Department of Labor. We are thrilled to be growing our office working on these matters. And with that, Madam Secretary, will you please announce the next date for the Commission's monthly agenda meeting?
The next agenda meeting of the Federal Communications Commission is Thursday, November 21st, 2024.
I got us out before lunchtime.
Yes.
Until then, we stand adjourned.
First.
Morning, everyone. If you could take any outside conversations to the foyer, we're going to get started with the Chairwoman's post-open meeting press conference in a minute. If you could please take any outside conversations outside the room, that would be really appreciated. All right. And with that, Chairwoman, I'll welcome you to the podium. Take a couple of questions.
All right. Go ahead.
Press the right button this time.
Yeah.
Good morning, Madam
Good
Chair.
morning. Yeah, we're about a minute or two before good afternoon.
Yes.
Yeah.
Cutting off that deadline. So I have 2 questions for you today, but I'll start with my first on the geo-routing of 988 calls. Poison control hotlines have wanted similar geo-routing treatment of calls made to them. Do you foresee the agency moving on this? Are there any other emergency hotline type organizations where requiring geo-routing calls to them might make sense?
It's a good question. We have unique responsibilities when it comes to 988 as a result of congressional legislation. So we've worked with our colleagues at the Substance Abuse and Mental Health Services Administration to set up 988 and to make sure this technology is deployed. We'll have to look into what our statutory authority is in other similar contexts. But in this case, it's based on unique obligations to set up 988 that are in the law.
And my other question was on, I think my count now is there are 4 major items that the FCC is battling in courts over. We've got Title II, digital discrimination, consumer research's USF challenge, and then, as you're probably aware recently, the multiple challenges on incarcerated people's communication services. So with those 4 big items, with the FCC dealing with those in the courts, I mean, how are you feeling about that? What does this say to you that some of the biggest issues that you've taken up under your chair your time as chair recently, they're, you're fighting them off in court right now?
Well, I have full confidence in the work of the FCC and the decisions that we've made. We'll defend them in court.
Hi, Chairwoman. Thank you for doing this. My question is in regards to the Maternal Health Data Mapping Initiative. I just wanted to ask, can you detail any next steps for the map? When will it officially launch?
I'm going to ask the team to get back to you on an official date. It is next month. We wanted to take the opportunity of an open public meeting to display what we've done. It is an incredible improvement over the first version. There is so much more that researchers and stakeholders can take a look at. So this was an effort to make sure that publicly it's known that this is coming and that there's a lot of possibilities in looking at this data in the future.
Are there any further other details that you think should be added to the map as we get closer to the launch date?
It's a good question. I think our goal right now is to put it out and to look to researchers, healthcare specialists, and policymakers and say, what patterns do you see here? What information is new? What information is missing? How can this inform our policy choices with respect to healthcare and with respect to broadband deployment, affordability, and access? So my hope is that we get this map out, we share it broadly and widely, and we can start figuring out just what those questions are.
Thank you.
Thank you.
Thank you, Chairwoman. And with that, I welcome my colleague Katie Gorsak to lead the Bureau press conference.
Hello. So we're going to cover our 2 meeting items. So any questions on today's 2 meeting items? We'll start with the Wireless Telecommunications Bureau item on handset compatibility. Are there any questions? Awesome. So if the team could just come up. Go ahead.
Hi. So just a pretty quick question. If you could share if there's any changes to the final item from the draft.
Yeah, I think we did make some changes at the margins in response to some of the stakeholder comments that came in, accessibility advocates and CTIA, and also in response to a few of the commissioners' requests as well, which I think you heard a few of them referred to in the comments.
Thank you. Okay, we'll next move on to the 988 Geo-routing. Questions on this? Okay. Trent and team, you want to come on up?
Hi.
We are now in the PM. Good afternoon instead of
Is
good
it-
morning.
is it?
Yes, it is. We are now in the afternoon.
When did that happen?
So, same question to you. Could you share whether there were any major changes from the draft?
Yeah, no major changes. We did make some, we have people who file ex partes with us in support of what we're trying to do, also asking us to clarify some of the requirements, which we did. We also had a couple of references to like public notices and petition or press releases out there showing the updates of where the nationwide carriers are in their geo-routing and when they started and things like that. So like we try to update the record in that respect. Yeah. Good.
Okay, well then that will conclude our Bureau press conference. I believe Commissioner Carr is available for his, so I will conclude this one. Thank you so much.
Hey, good to see you all. Not a lot of press today, but happy to chat with you all. It's been, my counter, I think, has it as day 1,067 that Vice President Harris has been leading the $42 billion broadband effort and update. Still 0 people connected, still 0 projects underway. But with that, happy to take any questions you got.
Good afternoon, Commissioner. So I will start with my first question, and that's there was a report yesterday about the Trump campaign transition team preparing a list of potential Republican staff to blacklist from jobs if he wins. It includes contributors to Project 2025. Are you concerned about your participation in that, that it would potentially jeopardize your chances of becoming chair under a Trump presidency?
I don't have any comment on that. That's obviously sort of inherently political, and so I'm here in my official capacity, so no comment on that one.
Okay. And then I also want to ask whether you think the FCC should potentially investigate CBS for news distortion over its interview with Vice President Harris, which former President Trump has repeatedly suggested.
Yeah, I think I've been pretty clear on these issues. You know, these types of things have come up a lot, and I've been very consistent in my approach, which is every decision that the FCC makes should be based on the law, the agency's precedent, and be consistent with the First Amendment. And that's the same standard that I would bring to bear to any issue brought before the agency.
Thank you.
Good. Round two.
Well, I guess I would just say, is there any updates that you'd like to share with us? Anything that you think is important for folks to be paying attention to right now?
Yeah, it's been 1,067 days. Already get the line. No, we're good. Nothing else from me. All right, appreciate it. See you guys next month.